Hello friends, I am Dr. Ankit Goyal and today we will be discussing the psychiatry portion of Grand Test 184. So let us discuss the first question, that is question 166. The question is, which of the following statement is correct regarding the given test? So there is an image given and the options are, option A is a test for organicity of disease, option B is a subjective test, option C is a test for personality, and option D all of the above. So the correct answer to the given image is option C, that is it is a test for personality. Now let us discuss about this question. So the correct answer is C, it is a test for personality. So what is this test which is shown in the image? This test is known as Rorschach test. Or in fact it is Rorschach ink blot test. So this was one of the ink blot which was shown in the image. Now this is one of the Rorschach test is one of the projective personality test. The projective personality test or the projective tests are basically based on the principle that the way a person responds to a vague or an ambiguous stimulus So the way a person responds to a vague or an ambiguous stimulus generally reflects his hidden feelings, emotions, or any hidden inner conflicts. So in Rorschach test, there is these ink blot tests. These ink blots are basically vague or ambiguous stimulus. So the way the person will describe them will generally show or reflect his inner feelings, emotions, or conflict. Or in another way, these are basically tests in which the person projects his own feelings on the card. So that is why they are known as projective test. Now in Rorschach test, if we discuss about Rorschach test, it was given by Hermann Rorschach. Now Hermann Rorschach was a Swiss psychiatrist. Here there are basically 10 such cards. So there are 10 ink blot cards. Card number 1, 4, 5, 6 and 7, they are complete achromatic cards. So they are black and white, they are complete achromatic. Then card number 2 and 3, these are partial achromatic cards. And the remaining cards, that is card number 8, 9 and 10, these are complete chromatic. So they are colorful cards. So these are the various cards which are used in Rorschach test. Now similarly, various other projective test includes, second important projective test includes thematic apperception card. So thematic apperception test, or also known as TAT. Now in this card there are various pictures of some people in the cards, and the person is asked to build a story based on seeing the card. So this is thematic apperception test. Then other tests include draw a person test, and fourth is the sentence completion test. So these are some of the important projective personality tests. Now these basically help us to understand the hidden emotions, feelings, conflicts, and subsequently we may be able to tell based on the results of these tests whether there are any symptoms of any psychiatric illnesses other than the personality assessment. Disorders like schizophrenia, depression or mood disorder including mania, anxiety disorders, OCDs. So we can get the possibility, we can get there that what kind of disorder may be present. Although these are not confirmatory tests, but still these, the responses which a person make may help us to tell whether the person is having symptoms of these diseases or not. Then similar to the projective test, then there are objective test of personality. Also known as the paper and pencil tests. These may include questionnaires in which the person may have to give his answer either in true or false or a yes or a no. Then another important objective personality test is the MMPI or the Minnesota Multiphasic Personality Inventory. And another important objective personality test includes the CPI or the California Psychological Inventory. So these are some of the tests of personality, both projective as well as objective personality tests. Now let us discuss the next question. That is question 167. A 39-year-old female woman presents to the outpatient mental health clinic at the request of her oncologist 3 weeks after being diagnosed with metastatic breast cancer. So she is suffering from tumor. The patient denies strong feelings in relation to the diagnosis, but talks a great deal about the epidemiology of breast cancer and the available treatment options. So they have asked which of the following defense mechanism is she using. So the options are A, sublimation, B, intellectualization, C, rationalization, and D, dissociation. So the correct answer to question 167 is option B, that is intellectualization. So here the answer is B, that is intellectualization. Now, before discussing about intellectualization, let us discuss in brief about defense mechanisms. Now defense mechanisms are basically various technique. Now as we will discuss that according to Sigmund Freud, the structural theory of mind by Sigmund Freud divides the mind into id, ego, and superego. Now, id is our basic instincts, it's our basic drives and basic instincts, whereas superego is deals with our consciousness, the ideal way we should deal in the society. So id, like basic instincts like food, hunger, thirst, sex, these are the instinctual drives on which a person is, the id follows these drives. And superego is basically how a person should ideally follow all the rules and regulation. Now, ego is the balancer between the two. So, ego uses various techniques. So, the ego uses various techniques whenever there is a conflict between the id and the superego. So, the ego uses certain techniques to resolve these conflicts, and these techniques are what is known as the defense mechanism, also known as the ego defense mechanisms. Now, initially they were given by Sigmund Freud, and later on there were other mechanisms which were added by other authors as well. Basically, according to the George Variant classification, these defense mechanisms are divided into 4. The narcissistic or the psychotic defense mechanisms, then immature defense mechanisms, neurotic defense mechanism, and the mature defense mechanism. So, these are the 4 categories into which the defense mechanism have been categorized or classified. Now, the intellectualization is basically a neurotic defense mechanism. Now, here as we have seen that the female in the question is suffering from a breast cancer. Still, she is not showing her emotions, but is in fact involved in the knowing the epidemiology of the disease. So, this is a intellectualization kind of defense mechanism. Here, the person generally controls his or her conflicts or emotions by way of thinking about them. Rather than actually experiencing them. So here, for example, if a person has using intellectualization as a defense mechanism and he is being diagnosed with a severe illness, so the person, rather than showing the emotions that I am worried or I am distressed knowing that I have tumor, so in this they would ask more about the disease process, what is the etiology, what is the causing factors, what is the prognosis, so what is the epidemiology. So they will ask these intellectualizing questions rather than showing their emotions or what they actually are experiencing. So this is one of the neurotic defense mechanism which is used by the women in this question. Now let us discuss the next question. Now the next question, question 168, following are theories of Sigmund Freud except A. Topographical theory, B. Psychosexual theory, C. Psychosocial theory, and D. Structural theory of the mind. So the correct answer to question 168 is C, that is psychosocial theory. This was not given by Sigmund Freud. So the correct answer is C. The option C was not given by Sigmund Freud. So let us discuss about Sigmund Freud. A very important person to know in psychiatry. You should always know who is Sigmund Freud. In fact, it is very important, previously asked as well. He was born on 6th May 1856. He was born in Freiburg, Moravia, which is now in Czech Republic. So also important to remember where he was born. He was born on 6th of May 1856 and he died on 23rd September 1939 in London. Now, Sigmund Freud is also known as the father of psychoanalysis. Now, some of the important theories which were given by Sigmund Freud include: first, in 1900, in his book The Interpretation of Dreams, he gave the topographical model of the mind. So he divided the mind So he gave the topographical model of the mind. So he divided the mind into three parts. The conscious mind, where all the perceptions of the outside or the inside world are brought to our awareness, the conscious mind. Second is the pre-conscious mind. Now here the content is not generally under our awareness but can be brought to our awareness by focused attention. Then third is the unconscious mind. Now here the contents are generally kept away from our awareness. So this is how he divided the mind based on the topographical model of mind. Then another important theory which Sigmund Freud gave in 1923 was the structural theory of mind. As we had just discussed, that here he divided the mind into id, ego and the superego. So basically id is the unconscious basic instincts which generally like hunger, sexual drive, thirst, these are the basic instincts and it works on the pleasure principle. That is why it seeks pleasure. This is the ultimate aim. Then ego is also known as the executive organ of the psyche because it balances between the id and the superego. And superego, now before that, the ego, now as the id works on the pleasure principle, the ego works on the reality principle. Now superego basically it's the maintenance of our moral standards. So how a person should behave in a society ideally, this superego works on this principle. So obviously when there is id and superego, there are two poles apart, so there will always be a conflict. So this conflict of the mind generally is balanced by the ego. Now Sigmund Freud also tried to correlate both the models. Let us see how. He in fact tried to correlate both the models. So this is the conscious, preconscious and the unconscious part of the mind. Now generally the id is basically completely in the unconscious part of the mind, while both ego and superego runs throughout again. So this is how we divided. Now this, the ego in the unconscious part of the mind, this is where there lies the defense mechanism. So basically the defense mechanism are the unconscious part of the ego. Unconscious part of the ego, these are the techniques which generally balance whenever there is a conflict between the id and the superego. So these are two important models which were given by Sigmund Freud. Then Freud also gave the psychosexual stages of development. Now according to it, he derived that there are 5 stages through which a person generally moves. The first is the oral stage, which generally is from 0 to 18 months. Then the anal stage, which is from 1st to 3rd year. Then there is phallic stage, which is from 3 to 5 years. Then there is latency or the latent phase, which is from 5 to 6 years to around 11 to 13 years. And then there is a last stage, the genital, which is from 11 to 13 years up till young adolescence. So this is how, according to Freud, a person moves from various stages, and if a person generally is not able to resolve to say, let us say, to any particular stage, so there are certain disorders which may be there, which may be present. So this is how the psychosexual stages of development was given by Sigmund Freud. Freud also gave some of the various other concepts in psychoanalysis. As we had discussed that he is known as the father of psychoanalysis. Now he gave the concept of free association. So in his practice, what Freud would do was, he would ask the patient to lie down on a couch, and he would sit in a position, in a place where the person or the patient would not be able to see him, and he would ask the patient to say whatever comes to his mind. So this is a concept of free association by which Freud was able to give so many theories. Now he also explained, he also gave another term, slip of the tongue or parapraxis. So Freud said that whatever generally we unintentionally say, or generally we say in layman term that it's a slip of a tongue, is generally a reflection. It generally reveals or reflects our hidden or unconscious intent. So again, parapraxis or slip of the mind concept was again given by Sigmund Freud, and of course the ego defense mechanisms were also given by Sigmund Freud. Now let us discuss the next question. Question 169, which of the following is not true about dyslexia? Option A, dyslexia is neurobiological in nature. Option B, dyslexia is characterized by difficulty in word recognition. Option C, dyslexia is phonological deficit, and option D, dyslexia causes people to read words backwards. Now we'll discuss about dyslexia, which is a specific learning disorder. So the correct answer to question 169 is option D, that is dyslexia causes people to read words backward. It is incorrect. So the correct answer of question 169 is option D. Now SLD or the specific learning disorders. Now these are neurodevelopmental disorders. The specific learning disorders or disabilities, these are neurodevelopmental disorders, and generally there are three types. First is the impairment in reading. The first is impairment in reading, or also known as dyslexia. So there is impairment in reading. So here there are reading as well as spelling difficulties. So a person will not be able to read well or will have certain spelling difficulties. He may not be able to spell the words. So now these are phonological deficits. So for example, so the way we hear the voice is how we understand the words, but sometimes there are phonological deficits. For example, DO we spell them as do, while SO we pronounce as so. But the person with impairment in reading or with dyslexia will not be able to understand this phonological difference, although they in writing they appear to be similar, but DO is do and SO is so. So this is impairment in reading. Then second important SLD is impairment in mathematics. So here the person will make mistakes in mathematics, in calculation, in various understanding the various concepts in mathematics. Now it is important to understand that these SLDs generally, if they are severe, generally they may present in the earlier classes. For example, in play school, in nurseries, or even in the first or the second, third standards. But sometimes these are not very severe, so the person is able to understand the smaller concepts. So in the lower classes, the person may not be able to pick up that a person is having these disabilities. So as and when the person moves forward in the other classes, so when the concepts become complex, the education becomes complex, these then may surface. So these impairments may surface then. Then third is the impairment in written expression. Now impairment in mathematics may also be known as dyscalculia. Now here in the impairment in written expression, now there will be problem in writing. The person may not be able to write properly. If it is in the initial level only, so a person may not be able to understand the difference between D and B. So he may have difficulties in letters, or he or she may write, instead of this he or she may write U like this. So there may be inverted letters, and sometimes there may be person may, for example, person may use capital and small letters without proper use. So he may sometimes use small letters, sometimes use capital letters. So there is problem impairment in the written expression, and sometimes it is not that only one of this may be present. Sometimes a mixture of these three, or sometimes even all the three may be present in a child. So this is about specific learning disorder or SLD. Now then the next question, question 170. What percentage of individuals with autism exhibit special abilities or splinter or savant skills? Options are A 80%, B 50%, C 25%, and D 10%. The correct answer is option D, that is 10%. Now autism, or now the autism spectrum disorder. In DSM-5, all the various type of these disorders now are clubbed together in a single umbrella term, that is the autism spectrum disorder. So this is a new change in DSM-5, and a similar change is being expected to come in the newer ICD-11. Now it is again similar to the SLD, it is also a neurodevelopmental disorder. It is a neurodevelopmental disorder, and there are two important characteristics of ASD or autism spectrum disorder. Previously it was also known as pervasive developmental disorder. So you need not be confused when the term pervasive developmental disorder is used. So it's a term which was used previously. Now there is two important clinical features which generally describes autism spectrum disorder. First, there is impairment in social communication. And second, there is restricted and repetitive behaviors. So there is impairment in social communication. A person does not communicate socially. He or she may be just engrossed in his or her own environment, would not communicate with the peers, would just maybe seen in the corner of a room sitting, even if there are a lot of other children around. He would not interact with them. So there is impairment in social communication. Similarly, there is restrictive or repetitive behavior. There will be certain behavior which will be repetitive. For example, a child may be continuously banging his head or his hand somewhere, or he or she may play with the toys in a very peculiar or a very particular way. For example, a boy given a car, toy car, may just take the tire out and just start playing with the tire instead of playing with the entire car. So this is how they present with certain restrictive and repetitive behaviors. Earlier, there was another third core feature was there, which is now removed from the criteria. So that was, there was aberrant language impairment, or there was impairment in the language. Now that is not considered as the core feature. These two are considered the core features of autism or the autism spectrum disorder. Now out of all the people with children with ASD, around 30% may also have intellectual disability. Now again, this intellectual disability is a newer term for previously which was called mental retardation. So 30% may have intellectual disability as well. Now other than we are talking about the deficits, but these children with autism sometimes may have what is known as precocious skills or the splinter skills or the savant skills. So these are some of the skills of great proficiency. So they may perform some activities with a great proficiency, maybe even better than the average population. So skills like calculating abilities, hyperlexia or the reading ability, they may read so well, although they may not be able to understand what they're reading, but some children may have very good certain abilities. Some of them may have very good music skills. So these are some of the skills a child with autism may have, which are generally very high proficiency skills, and generally around 10% of all the people with autism may have these skills. So the correct answer is 10%. Now the next question, question 171, a 17-year-old woman presents to the clinic reporting anhedonia, decreased energy and hopelessness. For the past 2 years, she denies drinking, smoking or use of any recreational drugs. Her physical examination results are normal. She denies any suicidal ideations. After some consideration, her psychiatrist decides to prescribe her with Bupropion. Now from the question we can get that she is suffering from depression and a antidepressant in the form of Bupropion is being suggested by the psychiatrist. Of the following, which of the following is a contraindication for usage of Bupropion, or in which we should generally avoid using Bupropion? Options are A, smoking, B, dysthymia, C, chronic fatigue syndrome, and D, bulimia. So the correct answer in this out of these options is option D, that is bulimia. Now bulimia, we should understand it is a eating disorder. Now let us discuss. So the correct answer is option D, that is bulimia. Now before that, let us discuss about few things about Bupropion. Now Bupropion is an antidepressant which belongs to the NDRI category, that is, it is the norepinephrine dopamine reuptake inhibitor. So it is a norepinephrine dopamine reuptake inhibitor, that is, it is NDRI category. Generally increases the norepinephrine as well as dopamine in the brain. Its T half is around 12 hours, although it may range from 8 to 40 hours, but average T half is 12 hours. Now what are the uses, various uses of Bupropion? So other than depression, it is also used for smoking cessation, very important. Many times this question has been asked that an antidepressant which is used for smoking cessation, so the answer would be Bupropion. It generally decreases craving in smoking. So it is very important to remember that Bupropion is an antidepressant which is used as an anti-craving agent for cessation of smoking. Then another use, although it's an offline use, is the use in ADHD, again very important. If a question asked an antidepressant which may be used in ADHD, then Bupropion. Now these are some of the uses of Bupropion. Now there are various side effects associated with bupropion, most common being headache, insomnia, then like dry mouth, tremors may be there, nausea may be there, and another very important side effect is seizures. So there may be seizure. In fact, it is a dose dependent side effect. And generally it occurs when we give dose more than equal to 400 milligrams a day. So generally it is a dose dependent side effect. Now in bulimia, as we know, in bulimia there is binge, there is a surge of eating in a binge pattern and subsequently vomiting it out. Now because of the vomiting there may be electrolyte disturbances, and if a person with bulimia is given bupropion, there is already electrolyte disturbances, and as we know that there may be seizure because of the use of bupropion. So these two may in fact lead to seizure episodes, so hence it should be avoided in a person with bulimia. Now let us discuss the next question, question 172. Which of the following is a component of good sleep hygiene? Option A, arising at the same time daily. Option B, eat larger meals near bedtime. Option C, take daytime naps as needed. And option D, establish physical fitness with exercise in the evening. So the correct answer is option A, that is arise at the same time daily. So let us discuss, very important, the concept of sleep hygiene. So the answer is A. So let us discuss the concept of sleep hygiene or the universal sleep hygiene. In fact, it is very important even for all of us. In fact, people who are studying, students who are studying, have a very important exams ahead. So these certain things are very important even for them. Now, what is universal sleep hygiene? Basically, it is basically certain environmental modifications and certain habit modifications which, if we all make, may help us to improve our sleep. So even normally, as well as people having some sleep disorders, so it will help all of us. So the sleep hygiene basically comprises of various do's and don'ts. So it comprises of various do's and don'ts, that is things we should do and things we should not do to improve our sleep. So what all are the things which are generally advised? So first is the regular hours of sleep. So one should always sleep at a fixed time and wake up at the fixed time, and out of the two, in fact, the more important again will be waking up at a fixed time. So if a person sleeps at, let us say, 11 o'clock and wakes up at around 6 o'clock, so it should always be fixed time. Second, if a person is hungry at night, he should have very light snacks. So a person should have very light snack even if the person is hungry at night. He should have regular exercise schedule, but one should avoid the exercise in the latter part of the day or in the evening or just before sleeping. Then one should wind up 1 hour. So one should wind up all the things 1 hour before one is sleeping. For example, if your sleeping time is, let us say, 11 o'clock in the night, and you are still, by 10:45 you are still busy in doing all your things, daily things, making phone calls, personal or professional. So one should definitely wind up all the things 1 hour before sleep. So one should keep all the things aside, that now my sleeping time has come and I should wind up all the things. And generally if you are preoccupied with anything, you should write it down. So one should write it down and should deal with those things in the morning. And another important aspect is that the bedroom should be cool, dark and a quiet place. So these are some of the do's one should follow to have a good sleep. Now coming to the don'ts, what we should not do to have a good sleep. The first is taking regular naps. So one should not do or not take regular naps in the daytime. Then watch the clock to know what is the time. For example, a lot of us have habit, if you are not able to sleep, we'll keep on checking the time. We should not do this. Then third is exercising just before sleeping. So we should have a regular exercise schedule, but we should avoid doing exercise, because again, and after exercise we'll become more energetic and will not be able to have a proper sleep. Then watch television. One should avoid watching television before sleeping or eating heavy meals. So even if you feel hungry, you can have light snack, but you should always avoid heavy meals, especially at the night time. One should avoid drinking tea, coffee in the evening. So generally we say after 4 or 5 one should not, in the evening one should not drink tea or coffee, again because they have caffeine, they have stimulant, so which will again may cause difficulty in our sleep. One obviously should not smoke or drink alcohol. As we know, these are already harmful, and especially these should be avoided in the night time. And also we should use bed only for sleeping, so we should not eat or exercise or read anything while sitting on the bed. We should use other places like a sofa or a chair for these activities. And also we should not talk on phone while we are on our bed. So we should avoid these activities, so that our mind generally has an association that whenever I come to bed I have to sleep. So this association should always be maintained. So these are the various don'ts and do's of a universal sleep hygiene, and these generally help all of us. Then the next question, which of the following is not a therapeutic effect for which cannabinoids are commonly used? So generally we know cannabis as a psychoactive agent. Now it is also sometimes previously in literature, and it is also being used as a therapeutic agent. So they are asking which of the following is not a therapeutic indication for cannabinoids. Option A, weight loss. Option B, reduced muscle spasticity. Option C, relief of nausea and vomiting. And D, decreased intraocular pressure. So the correct answer is A, weight loss. So the correct answer of question 173 is A, weight loss. Now what are the various therapeutic effects of cannabinoids? Now some of the important therapeutic effects of cannabinoids are, the first, it may be used as an analgesic agent. So for pain it may be used. Then it may be used for nausea and vomiting. And third, importantly, it may be used in wasting syndrome, and it is used as an appetite stimulant. So basically it increases appetite in people with HIV or AIDS. So in fact it increases weight rather than decreasing weight. So it is used in the wasting syndrome as well as an appetite stimulant in HIV and AIDS. Then it may be used in muscle spasticity, in movement disorders, movement disorders like dystonia, Huntington's chorea. Then it may be used in epilepsy. So these are not approved indication, but these cannabinoids have been found to have a good role in these situations. And again in glaucoma, because previously it was also, in fact, historically when we see, it was also used to decrease the intraocular pressure in glaucoma. So these are some of the important therapeutic effects of cannabinoids which generally are seen. Now the next question is 174. A psychiatric patient who, although coherent, never gets to the point and has a disturbance in form of thought, which is known as, the options are A, blocking, B, tangentiality, C, verbigeration, and D, circumstantiality. So the correct answer is that, important to remember that he never gets to the point, although the words are coherent. So very important to remember these things. So the correct answer of 174 is B, tangentiality. Is B, tangentiality. Now when we discuss the disorders of thought, we generally describe them under 4 domains: flow or stream, form, content, and possession. So these are the 4 domains under which we describe any disturbance of the thought. Now tangentiality is a disturbance of the form of thought. Now what happens in tangentiality? Generally a person, when answering any question, they generally reply in a very oblique manner, and generally they never return to the original thought. Very important to remember. They may start with the, it would appear that they are going to answer the question, but subsequently they go just like a tangent to a circle. So just they move in a tangent manner and they will just go out. They will not return back to the question. So this is tangentiality. In circumstantiality, here the person generally proceeds very slowly. He proceeds very slowly and gives very unnecessary, trivial details. But important to differentiate is that they reach the goal. So finally you may get the answer from them. While in tangentiality, they will never return to the original goal. So this is the important differentiation between tangentiality and circumstantiality. Let us discuss the next question. Question 175. In which condition the following type of brain wave as marked by the arrow is in the image is seen? So there are various waves which are given, and we have to tell that they are seen in which. So the options are A, awake with mental activity, B, awake with resting, C, sleeping, and D, deep sleep. Now let us discuss. Now they've also given the scale, the time scale on the x-axis. So the number of waves in 1 second generally tells the frequency. This is how we tell what kind of wave it is. So if we would look on the wave which is marked by the arrow, generally we would see, and if we would count that each second So in each second there are around 9 to 10 such waves. So there is frequency of 9 to 10 hertz in each of these in each second. So let us discuss what's the answer. So these waves basically are alpha waves. We'll discuss in details, and the correct answer then would become option B, that is awake with resting phase. In this the alpha waves are seen. So let us discuss. So the question 175, the right answer is B. Now when we discuss the waves, so generally you can remember the waves with the order of frequency as with the mnemonic D tab. So D, that is the delta with the least frequency, and beta with the highest frequency. So it is the increasing order of the frequency of these waves. So the first is the delta wave. Now these generally have a frequency of 3 hertz or below. So again, if you would see it in a, so if this is 1 second, so generally there will be there may be 3 or less than 3 waves in a second. So this is delta wave, and generally these may be seen in infants up to 1 year and in stage 3 and 4, now known as N3 stage of sleep. Very important. So D means which is seen in deep sleep. So delta waves are seen in deep sleep or the slow wave sleep. Then the second are the theta wave. They have a frequency of 3 to 8 hertz. So this is the theta wave, and these generally may be seen up to 13 years of age and also in sleep, like in the N1 stage of sleep of the NREM. Then third are the alpha waves. They have a frequency of 8 to 13 hertz. They are generally seen in the resting state, or when the person is resting state, that is when the person is awake with eyes closed. So then we will see alpha wave. And the last wave or the beta wave, they have a frequency of more than 13 hertz, and they are generally seen in the when the eye is open and in a alert state. So these are some of the waves and the various frequencies and the various conditions in which they all are seen. So this was about the psychiatric questions. Thank you everyone.